Tired of suffering from ringing and buzzing in your ear? Give me the opportunity to teach you some tips and exercises to combat and eliminate this annoying noise. Welcome one more day, one more week to Fisiolution, your physiotherapy, health and wellness channel. Isa, do you hear that beeping sound? Annoying, isn't it? Or is it more of a buzzing sound? How awful. Aren't you a little sick and tired of this buzzing, this discomfort? Well, I'm going to show you some tips and exercises to solve it. The most frequent cause of tinnitus or tinnitus statistically is exposure to loud noises. Continuous or repetitive exposure to loud noises such as loud music, industrial noise, or the use of headphones at high volume can damage the hair cells of the inner ear and trigger tinnitus or tinnitus. Age-related hearing loss. Presbycusis is the gradual hearing loss associated with aging. It is a very common cause of tinnitus. As we age, the sensory cells in the ear may deteriorate and cause the perception of phantom sounds. Finally, inner ear disorders. Some inner ear conditions such as Meniere's disease, acoustic trauma, or problems with blood circulation in the ear can cause tinnitus. All these conditions affect the function and structure of the inner ear, which can trigger the appearance of those annoying tinnitus and hated tinnitus. Guys, first, very simple exercise. In fact, those who go by plane or dive often do it a lot. It consists in doing a compression apnea. For that, we are going to stick our tongue on the top of the roof of our mouth and we are going to cover our nose blowing. In this technique, what we want to do is that the tympanic membrane performs an equalization, which is called the tympanic membrane that is separating the outer ear from the middle ear. If we have a buzzing or a whistling sound because of this, we are going to achieve a back and forth sound. Another thing we are going to do is to look at ourselves in a mirror or look at ourselves with another person and yawn. At the beginning, it is going to be very artificial, but simply thinking about yawning or seeing ourselves in a mirror yawning is going to make us balance. Yawning will balance the tympanic membrane and may improve our ringing or our whistling. We will be doing this technique for 3 to 5 minutes, and decompressions with 3 to 5 minutes will be fine. Remember, always without pain. If the ear hurts to do that, we stop because we may have an infection or inflammation that we will have to study. Second exercise, guys. We are going to mobilize the structure of the ear with something as simple as grabbing our earlobe with our 2 little fingers, and the movement is to pull outward. I'll describe it. It's not pulling in this position, it's pulling in this position. Follow the vector of my finger. Once we have the movement, what we're going to do is we're going to do little jerks. We'll do it 30 or 40 times. Let's see how Isa does it, who's never done it, and see if we can get it right. We take the little lobe and we pull on that vector, That's it. I'm going to do this one for a second. We locate the lobe, and instead of pulling downward or outward, it's following this vector. That's it. That's it. A ballistic movement that you're going to get to mobilize. We give it a little bit, you're going to get all right. You're going to do it 30 or 40 times, okay, in a 1-minute stretch. You're going to get your ear mobilized. Start to get more circulation going, and if there's something like a wax plug or something that doesn't need to be there, possibly move it. Even water after the shower that causes there to be a plug and it starts to give us ringing or buzzing. Guys, next exercise I want you to do. We are going to locate it in the occipital scale, in the little ossicle that we have here behind, where we have the greater occipital nerve or Arnold's nerve. Sometimes they are nervous problems and problems of releasing tension. For this, we are going to perform a very unique tapping technique. It consists of putting the second finger on the third finger and tapping the scale with this rhythm. Okay? Isa. We do it. Let's see how it goes. We put the second finger on top of the third one and tap it. I'm going to explain it and I'm going to do it, and then Isa is going to do it and see how it goes. Look, I'm going to give you a little bit of my back. the scale of the occipital, soft area up to the hard area. In the hard area, we are going to place our third finger, we are going to mount the second finger, and we are going to do and we are going to make a rhythmic tapping movement, slowly. We will do this technique for a minute. Let's see how our partner Isa performs it, to see how she adapts. Okay? So little hair on the sides, we put our little fingers until we find the bone. Then we open our little hands. We open our little fingers. That's it. We take stability even with our fingers and we give it. That's it. We join it a little bit more this way. That's it. And it is already producing that tapping. This tapping relieves the tension of the exit of everything that is in the occipital nerves, or many times there are Arnold's neuralgias associated problems, okay? We can even open the fingers a little bit to cover a little bit more external area. We are going to do this for a minute, okay? I don't have to correct anything to Isa because she is doing it perfectly. Fourth exercise. What if it is the chewing musculature and the one that surrounds our ear that is causing the problem? Well, easy and simple. With the thumbs of the fingers, we are going to put on the straightest ones to tighten the jaw. And there where the muscle grows, we are going to perform a massage between 3 and 5 minutes. Gentle, slow, circles forward, circles back, and sometimes changing the thumbs of the fingers a little higher or a little lower. Gentle and simple massage. If it hurts a lot, watch out, slowly, okay? Because we cannot give a very intense massage on an inflamed area. It would give us clues that the problem is coming from there. Second exercise that we are going to do for another 2-3 minutes, this time not 5. They are with the 2 fingers together. We are going to go to the temples, to what is the seno-basilar, okay? Where we are going to perform an anterior massage. 1 minute, minute and a half, and posterior rotation or posterior circles for 1 minute, minute and a half. Why? Because that bone interacts with all the bones that are in the skull, except for 2 or 3. But it's a point of a lot of tension where we have to release it. Finally, a chewing muscle, which is the temporalis, which comes from the temporalis area and is anchored in the antemporomandibular joint that helps us to chew. We are going to relax it. How? With a nail rub, which is basically with the fingers, we turn it around and we rub it from front to back. From front to back, above the ear, and we will give it different vectors, one horizontally, another one from top to bottom, from behind the ear, and one from the bottom to the top. That's it, perfect. Let me have your little head, Isa. Guys, let's leave the nails. We open our little fingers and we are going to give it fearlessly with different beams. This will relax a lot the muscles of the temporalis, and if in the end there is an imbalance in the chewing muscles, we will be working on the reduction and relief of ringing and whistling. Last exercise that I propose, and if the problem is in the joint, let's try to regularize the temporomandibular joint attached to the ear. Basically, what we are going to do is to open and close the jaw. We have to be able to perform this movement well. If we have a problem of opening, running to the dentist and running to the physio, because it may be that the lack of opening is giving you a problem in the joint and that gives you that buzzing. When we open the jaw, we are going to place one finger just behind and another finger just in front of the jaw. Close. Open, close, open. Locating the finger behind the joint, when we open, you will notice that it moves forward. And the finger in front of the joint, we will synchronize opening with a back and forth massage. You can do it in both ears, but as you are going to have more ringing, more whistling, always in one ear, I recommend that you start with the one that bothers you the most and try to be synchronous. What do we achieve with this? Touching ligaments and capsule behind the pterygoid musculature that helps chewing and mobilizing the temporomandibular joint in front. We are doing a kind of capsular massage that is going to help us regulate the temporomandibular joint. something that can cause you to have whistling, ringing, buzzing, tinnitus, or tinnitus as some people call it. I forgot, let's do this technique for at least a minute or 2 minutes. And before we go, because we don't think it might be a neck muscle problem, let's do the stretches that regularize the front and the back. The first one, double chin. With this hand, we take our chin, and with the other hand that rests on our head from behind, we are going to make a bending movement. With the other one resting on our head from behind, we are going to make a bending movement. My voice is going to go where we are going to stretch the whole back of the neck. We will do this in 2 batches of 40 seconds. After this exercise, to regularize the front part, we will do 2 exercises. One looking to your right, we will put the hand on the skin of the chest. We will drop the right ear backwards and we will pull with the hand, stretching all the musculature of the sternocleidomastoid, scalenus, and anterior musculature of the neck on the left. If we look to the other side, we change the hand. Pull the left ear back and pull with the hand. We will perform the contralateral stretch, making sure we stretch the back of the neck and the front of the neck, which, believe me, can create an imbalance and start making your ears ring or ring. Guys, very important physio advice. When we have this type of ringing or buzzing established over a period of time that you have had for months or weeks, you have to go to the doctor, to the otolaryngologist, and many times you ask me what type of doctor I have to go to. The best thing would be many times to do an MRI to study, or a CAT scan to study the whole skull and make sure that everything is healthy. Once everything is healthy, sometimes they give us medication, sometimes they refer us directly or by stress to the psychologist to make these ringing in the ear are very much associated with stress, or to the psychologist, or also to the nutritionist, since our diet also makes us enter into a dynamic in which we have whistling and ringing in the ear. Another thing, of course, is a good sleep diet. Someone who is stressed, someone who is sleep deprived, can suffer from ringing and buzzing. Why do I tell you this? Because I suffer from ringing in my left ear for 7 years, and my working mechanics to not suffer from those ringing sounds are physical exercise, consultations with the psychologist to treat my stress, a good diet, and trying to sleep when my body asks me to. I put everything aside and try to rest as much as possible. If you are watching this, I want to empathize with you. I am a person who suffers, and I have suffered a lot because I could not get to sleep at night because of the tinnitus. I want to give you some words of hope. Everything passes, everything is assimilated, everything gets better. Believe me, do these exercises, rely on a multidisciplinary team of medical professionals, and you will see how in the end, those ringing and buzzing sounds, if they do not disappear 100%, you will tolerate them, and they will become a very tolerable travel companion. As I always tell you guys, to healing and beyond, see you later.